We turn now to Florida Republican Senator Rick Scott, who joins us from Naples this morning. Senator, welcome to Face the Nation. You got your work cut out for you. President Trump said you are one of the senators in charge of coming up with a Republican alternative to Obamacare. When are we going to see your proposal?
Well, first off, I'm glad that the president cares about health care. I ran the largest hospital company. I care about the cost of health care, and that's what I focused on. I know it's going to be tough. I look forward to, to seeing what the president's going to put out. With Nancy Pelosi in the House, it's going to be tough to get something done. But we do know that Medicare for All, which Senator Sanders is all in on, is going to just ruin our healthcare system.
So it's
going to ruin
sorry,
Medicare,
just to clarify,
and it's also going to ruin private insurance.
Did you just say that you expect the White House to come forward with the proposal first?
Well, I know in the end the White House is going to have their plan, and I know it's going to be difficult with Nancy Pelosi. But what I'm going to focus on is how do you drive down costs? The Democrats constantly focus on access. The problem is the cost of health care is too high in this country. That's why I put a bill out this week that requires transparency at the pharmacy, with the insurance companies, and says we're not going to allow pharmaceutical companies to charge us more than what they charge in Europe. Mm-hmm. I had the same issue when I ran a large hospital company, and I did the exact same thing. I said, I had hospitals in Europe. I said, I'm not paying more for drugs in Europe than I'm paying in the United States. It's not fair to Americans.
It sounds like you and Senator Sanders
I'm going to work hard to get that passed. Well, we don't agree on much, but I'm glad he cares about prescription drug prices. But the problem that Democrats have is everything they keep doing is raising the cost of health care. Let's look at Obamacare. Premiums went up,
can you just put a button on this, though? Clearly, the White House is going to have to weigh in. And the White House acting chief of staff, Mick Mulvaney, was on other television programs this morning saying that he can promise no one will be left without health care if Obamacare is struck down. But as you've just said, there is no plan yet. So how can you promise that, like a state like yours, where it has the most people reliant on Obamacare of any state, how can you promise them they won't be left hanging?
Well, first off, Margaret, my focus is on and how do you drive down the cost of health care? That's what's causing people healthcare issues. I've been talking to a lot of people in my state about insulin costs. Why in the world would they go up the way they have? Now, the other thing,
but that's a cost of a plan.
Whatever happens with
what
Obamacare,
if they won't have a plan at all if Obamacare is struck down? Can you promise them that won't be the case?
Well, first off, I think it's very important that we make sure that people have a pre-existing condition can get a health care plan, get a health care plan that they can afford. And I want to work on that with other senators to make sure that happens. We talked about it at the Budget Committee last week, and everybody was supportive of that. I want to make sure individuals can stay on their parents' plans. But this idea of the government taking over health care and running all of health care has never worked. It's not going to work. We're going to ruin the entire system. Let's focus on the problem we have. The problem is not access. The problem is the cost of health care and the unbelievable inflation we've seen, especially, let's start with drug prices. Why are drug prices going up the way they have?
So you think this piece-by-piece approach is the best way to do it rather than a wholesale Republican alternative?
Look, I want to listen to everybody's ideas. I've sat down with the pharmaceutical companies, the PBMs, the insurance companies, the hospital industry, the pharmacies, to ask them their ideas. I think the best way of doing this is to get everybody's ideas and see what we can do.
So that sounds like the piecemeal.
Instead of what the Democrats keep doing is access.
Can you
I want to focus on driving down costs.
I'm sure people will like things cheaper. They always do. In terms of what they'll actually be able to get, though, can you say that the Republican alternative will do things like guarantee access to maternity care or care for newborn children, mental health, some of the things that are guaranteed in Obamacare?
First off, it's very important to me that people get health care. I will only support something where people have access to health care, but it's got to be at a price they can afford.
But on those particular instances,
I watched my mom cry that she couldn't get health care for my brother.
On those particular things, though, would it provide maternity care?
Well, of course. I mean, but Margaret, the president just put out a marker, what he wants to accomplish. I think all of us want to be helpful to try to get something done. We know it's going to be difficult with Nancy Pelosi and with the Democrats proposing Medicare for all. We know that. At the same time, what I'm going to do is what I believe we can get done. Let's focus first on prescription drug prices. They're way too high. We shouldn't be paying more than what they pay in Europe. It's unfair to Americans. And let's go piece by piece to try to fix it.
And don't expect a wholesale plan until after 2020?
You know, I'm going to continue to work on. I'm a business guy. The way I got my stuff done in business is every day. I said, what could I get done today?
Okay.
And I know a lot of people like the grand bargains. I personally don't believe in grand bargains. I believe in piece by piece fixing things.
Got it. And quickly, do you support the president's call to cut off aid to Central American countries who are sending migrants into the United States?
I'd have to learn more about it. What I went down to the border, we have a crisis. We need more barriers. So we have operational control. We need more people, and we need more technology. I'm very disappointed that I walked into this job 3 months ago with the government shut down, and the Democrats don't want to give any money for border security. That's wrong.
Senator, thank you very much. We'll be back in 1 minute with a lot more Face the Nation. Don't go away.